How's it going, guys? We have a very difficult acid-base question where a nearly identical one shows up on IM Form 7 for Clinical Mastery Series for 2CK. If you're studying for Step 1, I'll tell you what you need to know for the exam, but just bear in mind, this question, it's 2CK level, very fucking difficult. There are two requirements when we discuss salicylate toxicity, okay, for USMLE that I've been able to conclude based on this question. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question. 29-year-old woman. She's brought to the physician by her partner for increasing lethargy and ear ringing over the past 24 hours. She has a history of rheumatoid arthritis for which she takes aspirin, ibuprofen, acetaminophen, and steroids to manage the pain. Which of the following combinations of serum electrolytes and pH is most likely to be seen in this patient? So we have tinnitus, ear ringing, plus aspirin use. This is clearly aspirin toxicity. And the question wants to know the most likely acid-base disturbance. Now, these answer choices are very fucking weird, as I said. But I'm going to tell you what we normally expect, okay? So aspirin in the first 20 minutes causes an acute respiratory alkalosis. That's it. All right. So we're going to have a decreased CO2. We're blowing it off. We have an increased pH. That's our respiratory alkalosis. Bicarb, no change because the kidney cannot begin to compensate by excreting bicarb until at least 12 to 24 hours. Okay. So we would never see a decreased bicarb as compensation in 20 minutes. All right. So we're going to have decreased CO2, up arrow pH, no change bicarb in the first 20 minutes for salicylate toxicity. Then after 20 minutes, aspirin, salicylic acid itself is an acid. So it causes a concurrent metabolic acidosis. So we call this mixed respiratory alkalosis hyphen metabolic acidosis. Our CO2 is still low because we have the respiratory alkalosis. Our bicarb is now low because we have a metabolic acidosis, but it's not fucking compensation, as I said. Okay? It looks like compensation, but it's not compensation because if it were compensation, it would take at least 12 to 24 hours. So pH usually low, but can be normal. I've seen it variable on the NBME exams. And it's going to be a high anion gap metabolic acidosis because our mnemonic mud piles, salicylates is the S, okay? So a high anion gap metabolic acidosis, we calculate anion gap by taking chloride plus bicarb. We take that number and we subtract it from sodium. And it should be 13 or greater. 8 to 12 is normal. Okay. Now, I said there's two requirements on USMLE for aspirin toxicity for acid base, and I'm going to cut to the chase and now tell you what they are. The first requirement is that we have an increased anion gap in combination with a low bicarb. We need not have a low pH. Okay. And as I already told you, I've seen NBME questions where pH can be variable. CO2, obviously, if we're not only do we have the acute or have the respiratory alkalosis, but also CO2 could theoretically be low enough where pH is in the normal range. But the first requirement, we have an increased anion gap with a decreased bicarb. Okay, that combination must be seen. pH can be variable. All right. Our second requirement is that potassium must be normal. Okay, so the answer is C here. Now you say, but wait, what the fuck? Why is sodium low? Like, why is chloride specifically low? Can you help elucidate that? Good fucking question. Okay. Now, what I did is I took the IM Form 7 and they had numbers as the answers. Okay. And I just converted the numbers into arrows. That's what I did. I literally looked at the question and I just took the first 5 answer choices and I just converted the numbers into arrows. And it's identical. This question's identical. So if you disagree and you say choice C, I don't see why that would be the case. Take it up with IM Form 7. Not my fucking opinion, okay? So if we have to rationalize and justify what's actually going on here, the requirements are you must have an increased anion gap with a decreased bicarb, pH need not be low, and potassium must be in the normal range, okay? You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.